excited to welcome you to New Orleans, excited to welcome you to Union Bethel Church, and excited to talk all things Black health this morning.
It's exciting to be here in my home city of New Orleans, so I was at home, and really the energy is amazing because having my panelists from state and federal and local level who are talking about the importance of maternal health.
If we rise up, that is to revolt against the status quo and shift the way we think about pregnancy, parenting, and having babies, we can literally change the vibration of our communities. The solution really lies in places like this church and in our communities, and I am a firm believer of that.
Despite national and local efforts to address HIV/AIDS in the African American community, there's still a lot that can be done. So on tonight we had a dynamic panel where we addressed some strategies and some opportunities where community-based organizations can come together and have a seat at the table to address HIV/AIDS.
The most memorable moment for me is the conversation that was about who we're including in prevention efforts in the face of HIV, specifically as it relates to Black women and trans women. Sometimes, we don't talk about that. So I really loved it. I thought it was great.
Our panel discussion had to do with job creation and disparities as it relates to health in our communities. We talked about the intersection of financial resources or the lack of financial resources and how that impacts the health decisions that we make.
When we have unemployed homeless patients, what happens is it's a debate between paying for food, shelter, or your medications. And oftentimes, it's the medications that fall short. So it's definitely, of course, as any other individual, when your employment status is at risk, then your health is at risk.
When I think about how in which we advocate for the state of Black health and for better Black health equity right now during the Trump era, we have to be unapologetic in what we are asking for. We have to be realistic in how we are thinking about creating that change under, at times, conservative and many times harmful leadership on both state and national levels. But as we do so, we must reimagine what is possible. We have to think about how in which we bring the things that we know that are doing well in different parts of our communities, uplift them, talk about them, and even when others may bring them down, we have to talk about what is actually working and then use that and bring that to different areas across this country and network within ourselves and bring in intersectional solidarity, making sure that the communities that are most impacted by HIV and other chronic illnesses, that they are actually at the table all the time, are listening and uplifting those folks.